For the today's topic is regarding knee joint. Knee joint is known as modified hinge joint of synovial joint variety. The articulating surface is between the articular surface of medial and the lateral condyles of the femur, the trochlear surface of the femur, articular surface of the patella, and articular surface of medial and lateral condyle of the tibia. So all those things let's see in the diagram. This is known as the femur, this is known as tibia, while this is known as the patella. So this is known as the lateral condyle of the femur, medial condyle of femur, lateral condyle of tibia, and medial condyle of the tibia. So the joint which is found between lateral condyle of the femur and the tibia is known as lateral femorotibial joint, and the joint which is found between the medial condyle of the femur and the tibia is known as medial femorotibial joint. And there is a conjunct movement. It means some degree of automatic rotation during the flexion and extension of the knee joint takes place. That's why it is known as modified hinge joint, which is present between the femur and the tibia. Next one is the joint formed between the patella and the trochlear surface of the femur. That is known as patellofemoral joint, and it is known as the saddle joint variety. But overall, it is known as the modified hinge joint type of synovial joint. We have divided the ligaments of the knee joint into two categories, extrinsic ligament and intrinsic ligament. Under the extrinsic ligament, capsular ligament, tibial or medial collateral ligament, fibular or lateral collateral ligament, oblique popliteal ligament, arcuate popliteal ligament. Under the intrinsic ligament, anterior and posterior cruciate ligament, medial and lateral meniscus, coronary ligament, meniscofemoral ligament, transverse ligament, and other ligaments. What we can include here is anterolateral ligament, medial and lateral patellofemoral ligament, posterior oblique ligament, medial and lateral patellomeniscal ligament, medial and lateral patellotibial ligament or retinaculum. Capsular ligament is a thin fibrous sac which surrounds the joint. It is deficient anteriorly, where it is replaced by patella, quadriceps femoris, medial and lateral patella retinacula, and the ligamentum patellae. So the capsular ligament is having the femoral attachment and the tibial attachment. So in the femur, it is attached about half to 1 centimeter beyond the articular margin with the following three special the features. So anteriorly, it is deficient in the middle, where it is pierced by the suprapatellar bursa, and this suprapatellar bursa is attached to articularis genu muscles. You can see here, this is a gap for the suprapatellar bursa anteriorly. Posteriorly, it is attached to the intercondylar line. Laterally, it includes the origin of popliteus muscle. Now let's see the attachment in the tibia. So it is attached about half to 1 centimeter beyond the articular margin with the following three features. It means anteriorly it descends along the margin of condyles of the tibial tuberosity, where it is deficient for the attachment of ligamentum patellae. Same how in the posterior aspect, it presents a gap behind the lateral condyle for the passage of the tendon of popliteus muscle. This synovial membrane, it lines the inner surface of the capsule, part of the bone within the capsule except some articular surface, and also to the margin of the menisci. In the infront, above the patella, it communicates with the suprapatellar bursa. In front and below the patella, it covers the deep surface of infrapatellar, the pad or fat. It includes the cruciate ligaments and the tendon of the popliteus. Intercondylar septum, it is a double fold of synovial membrane which includes the cruciate ligament. Infrapatellar fold, it is a small double layer backward extension of synovial membrane below the patella. And we have the alar fold, it is small double layered backward extension of synovial membrane lateral to the infrapatellar fold. Ligamentum patellae, it is derived from the tendon of quadriceps femoris muscles. It means rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. It extends from the apex of the patella to the tubercle of tibia or to the tuberosity of the tibia. You can see here in the diagram, this is known as the patella. And this is known as the apex, and this is known as tibial tuberosity. So this is attached from the apex to the tibial tuberosity, and it receives the small expansion from the vastus medialis and the vastus lateralis from the either side, and it helps to support the capsular ligament from the anterior aspect. It is also related with the subcutaneous and the deep infrapatellar bursa. Let's know about oblique popliteal ligament. It is a recurrent expansion from the tendon of semimembranosus. It extends upwards and laterally from the posterior surface of medial condyle of tibia to the lateral part of intercondylar line of the femur. It blends with the posterior surface of fibrous capsules and forms the floor of the popliteal fossa. It means it supports the fibrous capsules from the posterior aspect. While this oblique popliteal ligament is pierced by middle genicular nerves and vessels and genicular branch of posterior division of obturator nerve. It supports the fibrous capsule that is from the posterior aspect. You can see here in the diagram, this is a tendons of the semimembranosus muscle, and can see the expansion which is present in the posterior aspect of the knee joint. This is known as oblique popliteal ligament. Tibial collateral ligament, also known as medial collateral ligament. It is a strong, long, about 10 cm thick and flat band of fibrous tissue. It is having apex, you can see here in the diagram, which is attached to the medial epicondyle of the femur. It is having two parts, superficial and the deep part. Superficial part is attached to the upper part of the medial border and the medial surface of the tibia. You can see here in the diagram, tendons of sartorius, gracilis and semitendinosus crosses its lower part superficially. While it is having deep part is attached to the fibrous capsule, peripheral margin of the medial meniscus, and finally attached to the medial epicondyle of tibia. There must be some structure which is passing between the superficial and the deep part, that is the inferior medial genicular nerves and vessels, as well as the semimembranosus muscle. Morphologically, it is derived from, or we can say it is regarded as expanded tendon of adductor magnus muscle. And this medial collateral ligament, it is weaker than the fibular collateral ligament. Let's know the function. It resists the excessive abduction of the leg at knee joint, called as valgus stress. That is the primary action or the function, and the secondary is stabilizer to the anterior translation and the internal rotation. Fibular collateral ligament, also known as the lateral collateral ligament, it is stronger than medial collateral ligament. It is 5 cm cord-like structure. Above, it is attached to the lateral epicondyle of the femur. You can see here in the diagram. Somehow, below it is attached to the head of the fibula, and it is overlapped by tendon of the biceps femoris, while tendon of the popliteus separate it from the lateral meniscus, and lower part is separated from the capsules by the infralateral genicular nerves and vessels. While this is morphologically a primitive origin of the peroneus longus. Function, it supports the lateral aspect of the knee joint, and it resists the excessive adduction of the leg at knee, called as varus stress, and resists the external rotation also. You can see here in the diagram, this is lateral meniscus, this is tendon of the popliteus, and this is another fibrous capsule, while this is known as the fibular collateral ligament. So this popliteal ligament separate the lateral meniscus from the fibular collateral ligament, and you can see here the infralateral genicular nerves and vessels is present between the fibrous capsules and the fibular collateral ligament. Arcuate popliteal ligament, it is Y-shaped fibrous band. It is having stem, anterior and posterior limb. The stem, you can see here in the diagram, it is attached to the styloid process of the fibula. Posterior limb, it is arching over the tendon of the popliteus, and it is attached to the joint capsules, to the oblique popliteal ligament, and finally to the posterior border of intercondylar area of the tibia. While the anterior limb, sometimes it is present and sometimes it is absent. It passes deep to the fibular collateral ligament, as you can see here in the diagram, and it is attached to the lateral condyle of the femur. It helps to provide the strength to the knee joint from the posterolateral aspect. And you can see here in this diagram, this is also an arcuate popliteal ligament. Coronary ligament, you can see here in the diagram, it is a part of the fibrous capsules which is attached to the peripheral margin of medial and the lateral menisci to the tibial condyles. It supports the stability of the knee joint and prevents the anterior tibial translation. Next ligament is known as the transverse ligament. You can see here in the diagram. It is present in 45% of the population and which extends in the transverse manner. It is attached between the anterior horn of the medial meniscus and the anterior horn of the lateral meniscus. When the knee is being extended, the ligament prevents the anterior horn of menisci from moving forwards and the condylar surface of the femur and tibia from exerting pressure on the menisci. So this is the function of the transverse ligament. Same how we have the meniscofemoral ligament. It connects the posterior horn of the lateral meniscus to the medial femoral condyles. It is having two parts. You can see here in the diagram. This is known as the meniscofemoral ligament. So it is having anterior part and the posterior part. Anterior part is also known as the ligament of Humphrey, and also posterior ligament is known as the ligament of Risberg. It passes in front of and behind the posterior cruciate ligament, and it regulates the forward movement of lateral meniscus during extension. Cruciate ligament, it is intracapsular but extrasynovial ligament, cross shape, that's why it is known as cruciate. So there are two cruciate ligament, anterior cruciate ligament and the posterior cruciate ligament. One or other is taught during all position of the knee joint, either in the flexion or the extension of the knee joint. So before dealing about the anterior cruciate ligament, we have to know that this is known as the intercondylar area of the tibia. So this is known as the medial side and the lateral side of the condyles of the tibia. This area is known as intercondylar area. Well, this is known as the anterior part and the posterior part of intercondylar area of the tibia. So MCL, Medical College of Lucknow. So we know the mnemonics. M means anterior horn of medial meniscus. C means again the anterior cruciate ligament. L means anterior horn of lateral meniscus. Same how in the posterior part of intercondylar area of the tibia, the posterior horn of the lateral meniscus. In the middle, posterior horn of the medial meniscus, and in the most posterior part, the posterior cruciate ligament. So let's know about the anterior cruciate ligament, which is present between the anterior horn of the medial meniscus and the anterior horn of the lateral meniscus. So attachment below, it is attached to the anterior part of intercondylar area of the tibia, that is present between the anterior horn of medial and the lateral meniscus. Above, it is attached to the posterior part of medial surface of lateral condyle of the femur. Imagine that this is known as the lateral condyle of the femur, while this is known as the lateral aspect of the lateral condyle of the femur, and this is known as the medial aspect. So this anterior cruciate ligament comes and attaches to the posterior part of medial surface of lateral condyle of the femur. While this anterior cruciate ligament, it is oblique, so it runs upwards, backwards and laterally. Relatively, it is poor in blood supply. So we have to know the function, that is, it binds the bones together, prevents the hyperextension and anterior displacement of the tibial condyle on the fixed femur, taut during the time of extension of the knee joint, and forms a vertical axis for the femoral rotation during extension or the flexion of the knee joint. Posterior cruciate ligament. So let's know the attachment. Below, again, it is attached to the posterior part of intercondylar area of the tibia, that is behind the posterior horn of the medial and the lateral menisci. Above, it is attached to the anterior part of lateral surface of medial condyle of the femur. This is known as the medial condyle. So this is the medial surface of the medial condyle, while this is known as the lateral surface of the medial condyle of the femur. So it is attached to the lateral surface of medial condyle of the femur. It is less oblique compared to the anterior cruciate ligament. It is directed upwards, forwards and medially. Function, it binds the bone together. It is taut during time of flexion, prevents the hyperflexion and backward displacement of tibial condyles on the fixed femur, and it is more stressed during walking heel down, that is walking downstairs. You can see here, this is known as the posterior cruciate ligament. The meniscus, it forms an incomplete partition. It is composed of the fibrocartilage. So there are two horns, anterior and the posterior horn of both the meniscus, which is attached to the intercondylar area of the tibia with the help of the ligaments. So there are two surfaces, the upper surface which is concave and lower surface flat. In cross-sectional studies, it is wedge shape. It is having two margin, the outer margin and the inner free margin. So there are two meniscus, medial meniscus and the lateral meniscus. Let's know about medial meniscus. It is semilunar in shape. It is elongated C shape. It is anteroposteriorly, if you see, it is longer than the lateral meniscus. Anterior and the posterior end is attached to the intercondylar area of the tibia. Anterior horn, it is narrow, while this posterior horn, it is more wider. Outer margin, if you see, it is attached to the fibrous capsules, and finally again it is attached to the deep part of the tibial collateral ligament. It is attached to the fibrous capsules and the deep part of tibial collateral ligament with the help of the coronary ligament, and it is relatively more fixed than the lateral meniscus. Let's know about the lateral meniscus. It is circular in shape. Both horns are equal in width. Posterior horn, it is attached to the meniscofemoral ligament, as you can see here in the diagram, and a small part of the posterior horn is also attached to the tendon of popliteus. Lateral meniscus, it is more mobile than the medial meniscus. So let's know the function of the menisci. It increases the concavity of the tibial condyles, which act as a shock absorber. It means protection of the articular cartilage will be there. Helps in complex mechanism of gliding and angular movement, and it also helps in distribution of the synovial fluid. If you see the nutritional supply of the meniscus, peripheral part is supplied from the capsular blood vessels and inner part is supplied from the synovial fluid. So these all are the extra ligament, or we can say extrinsic ligament of the knee joint. So anterolateral ligament, it is present on the lateral region of the knee joint, that is anterior to the lateral collateral ligament. As you can see here in the diagram, this is fibular or the lateral collateral ligament. Anterior to that, we have the anterolateral ligament, and that is and posterior to the Godis tubercle. You can see here, this is GT means Godis tubercle. So origin is from the lateral epicondyle of the femur, and insertion is in the anterolateral aspect of proximal part of the tibia, that is on the lateral tibial condyle, that is halfway between the Godis tubercle and the tip of the fibular head. So it plays an important role in stabilization of the tibial internal rotation at varying degree of the knee flexion. Next ligament is known as lateral patellofemoral ligament. So it extends from the supralateral part of the patella to the lateral femoral epicondyles. The important function is it acts as a lateral stabilizer of the patella against the medial subluxation or the dislocation. Can you see here in the diagram, this is known as the patella, and from the lateral margin of the patella, there is a ligament that is known as lateral patellofemoral ligament and attached to the lateral epicondyle of the femur. Next ligament is known as medial patellofemoral ligament. So origin is between the medial epicondyle of the femur and the adductor tubercle. So insertion is in the supromedial aspect of the patella. Rupture of the medial patellofemoral ligament may allows the lateral dislocation of the patella. The medial patellofemoral ligament resists the lateral migration of the patella, and this ligament is more affected between 0 to 30 degree of flexion, and it keeps the patella centered along the front of the knee, that is within the femoro or patellofemoral group. Can you see this one is known as the patellofemoral group? So both the ligament tries to keep the patella in this group. So if there is a damage of the medial patellofemoral ligament, can you see there is a subluxation of the patella towards the lateral side. Posterior oblique ligament, it is attached above from the adductor tubercle, that is posterior to the medial collateral ligament, and below it is attached to the posterior aspect of the tibia. Function is to control the anteromedial rotatory instability and to provide a static resistance to the valgus load when the knee is fully extended. Let's know the other ligament. You can see here in the diagram. So medial and the lateral patello-meniscal ligament. This is known as lateral patello-meniscal ligament, which is attached from the patella to the lateral meniscus. Well, this is known as the medial patello-meniscal ligament, which is attached from the patella to the medial meniscus, or we can say meniscus. So we have again on the either side medial and lateral patello-tibial ligament and or the retinaculum, which is attached from the vastus fascia, because in the patella, so the vastus medialis, lateralis and intermedius comes and attach here, and it is from there the ligament is attached from the patella to the tibia. The bursa which is present near the knee joint. So there are approximately 12 bursa which is present near the knee joint. So the bursa will be present in the anterior aspect of the knee joint, posterior, medial and the lateral. Let's see the 4 bursa which is present in the anterior aspect of the knee joint. So you can see here, first one is known as subcutaneous prepatellar bursa. So it is also known as housemaid bursa, present in front of the lower half of the patella and upper half of the ligamentum patellae and the tibial tuberosity. Second one is known as subcutaneous, the infrapatellar bursa and the deep infrapatellar bursa. This is subcutaneous and this is known as the deep. So subcutaneous, it is present between the skin and the smooth lower part of the tibial tuberosity, and the deep infrapatellar bursa, it is present between the ligamentum patellae and the tibial tuberosity. Then we have the suprapatellar bursa that above. It is present between the anterior surface of lower part of the femur and the deep surface of quadriceps femoris muscles. You can see here all these 4 bursa is present in the anterior aspect of the knee joint. Same how on the posterior aspect, so we have the bursa between the lateral head of the gastrocnemius and the capsules of the knee joint. This is lateral head of the gastrocnemius and this is known as the joint capsules. Same how the bursa present between the medial head of gastrocnemius and the capsules of the joint. Brody's bursa, it is also known as Brody's bursa, that is present between the medial head of gastrocnemius and the joint capsules. In the medial aspect of the knee joint, so the bursa present between the tendons of sartorius, gracilis, semitendinosus and medial collateral ligament. So this bursa is known as Anserine bursa. And again, the bursa present between the tendon of semimembranosus and the medial collateral ligament. So these are in the medial aspect of the knee joint, so the bursa present between the tendons of sartorius, gracilis, semitendinosus and medial collateral ligament. So this bursa is known as Anserine bursa. And again, the bursa present between the tendon of semimembranosus and the medial collateral ligament. So these all are the bursa which is present in the medial aspect of the knee joint. This is semimembranosus and this is known as medial collateral ligament. Between that there is a bursa. Now in the lateral aspect, the bursa is present between the fibular collateral ligament and the tendon of the biceps femoris. Again, the bursa will be present between the fibular collateral ligament and the tendon of popliteus. And third one, it is present between the tendon of popliteus and the lateral femoral condyle of the femur. You can see here in the diagram, this is biceps femoris and this is known as lateral, the collateral ligament. Between this, there is a bursa which is present. And again, you can, next one is known as the bursa present between the tendon of popliteus and the fibular collateral ligament. And third one, again, deeper to that, that is the between the tendon of popliteus and lateral femoral condyles. Relation of the knee joint. Anteriorly, the relation is found by prepatellar bursa, ligamentum patellae. In the posteromedial aspect, it is found by semitendinosus, gracilis, semimembranosus, and medial head of the gastrocnemius. In the posterolateral aspect, the relation is by tendon of biceps femoris, common peroneal nerve, plantaris muscles, and lateral head of the gastrocnemius. In the posterior aspect, oblique popliteal ligament, the popliteal vessels, which consist of both artery and the vein, and the tibial nerve. Blood supply of the knee joint. So blood supply is by the 5 genicular arteries which is forming anastomosis near the knee joint. So those are the superior but lateral genicular artery, superior medial genicular artery, infralateral genicular artery, and inframedial genicular artery, as well as one more artery on the backside that is known as middle genicular artery. So all these 5 genicular is supplying to the knee joint, as well as descending branch of lateral circumflex femoral artery, the circumflex fibular branch of posterior tibial artery, and anterior and posterior recurrent branch of anterior tibial artery. So this all artery will be supplying to the knee joint. Nerve supply is by the femoral nerve, that is through its branches, that is vasta especially, or from the vastus medialis. Then next one will be the tibial and the common peroneal nerve through the genicular branches, and the third one is known as obturator nerve through the posterior division. Movements of the knee joint. So the movements will be flexion, extension, medial rotation, and the lateral rotation. The main muscles which helps in flexion is semimembranosus, semitendinosus, and biceps femoris. The other accessory muscles will be popliteus, sartorius, gracilis, the gastrocnemius, and the plantaris. Extension is done by the quadriceps femoris and the tensor fasciae lata. Medial rotation is done by semitendinosus, semimembranosus, and the popliteus. While the secondary muscles or the accessory muscles, that is by the sartorius and the gracilis, while the lateral rotation is done by biceps femoris, the gluteus maximus, and the tensor fasciae lata. Let's know about locking and unlocking of the knee joint, not in detail. For the locking and unlocking of the knee joint, I'll prepare the videos. Let's know the basic. Locking of the knee joint, it is due to medial rotation of the femur on the tibia during the terminal phase of extension, and the locking is done by the quadriceps femoris muscle, that is mostly the vastus medialis, and locked knee becomes absolutely rigid, and all ligaments are taut during time of the locking of the knee joint. So there is a 30-degree internal rotation of the knee joint takes place during the locking of the knee joint. Then we have the unlocking of the knee joint, lateral rotation of the femur on the tibia during the initial phase of flexion. It is done with the help of the popliteus muscle, and unlocked knee can be further flexed. All ligaments are relaxed during the unlocking of the knee joint. Applied anatomy of the knee joint. Osteoarthritis. Being a weight-bearing joint, the knee joint is commonly involved in osteoarthritis. Degenerative wearing and the tearing of the articular cartilage takes place, and movement will be painful and it will be limited. So there can be a damage of the cruciate ligament also. Anterocruciate ligament damage will be more common to posterior cruciate ligament, because it is commonly associated with the TCL injuries also, that is known as tibial collateral injuries. So mechanism, hit on the knee from the lateral side with the foot is fixed on the ground. So during that time, the anterocruciate ligament is mostly injured. Sudden and the severe hyperextension of the knee joint, and anterior dislocation of the tibia. So this can be a three reasons, main reason which damage the anterocruciate ligament. So whenever the anterocruciate ligament is damaged, so joint become unstable and anterior drawer sign positive will be seen. Can you see here, this is known as the ACL tear and the anterior drawer sign is positive. Same how posterior cruciate ligament injuries will be there, causes hit against the dashboard or hyperflexion of the knee joint, and effects will be again the joint will be unstable and posterior drawer sign positive will be seen. Can you see here in the diagram on the back side, this is known as posterior drawer sign. So there is another clinical aspect that is known as unhappy triads. So whenever from the lateral aspect, if the knee joint is hit while playing a football or by doing any work, so there can be a damage of anterocruciate ligament, the tibial collateral ligament, and even the medial meniscus injury will be there. So this condition is known as unhappy triads. The meniscus tear, it can be due to the forceful rotation and abduction of the knee joint in a flexed knee with the fixed foot on the ground, that is while playing the football, rugby, and the baseball. So during that time, there can be injuries of the medial meniscus. The medial meniscus is more prone to injuries than the lateral meniscus because of its fixity to the tibial collateral ligament, or we can say tibial collateral ligament is attached to the medial meniscus, and there is a greater exclusion during the rotatory movement. The lateral meniscus is being protected by the popliteal muscles because its medial part or the fibers pulls the posterior horn of the medial meniscus backside so that it is not crossed between the articular surface. So pain on the medial rotation of the tibia on the femur indicates injuries to the medial meniscus, while pain on the lateral rotation of the tibia on the femur indicates the injuries of the lateral meniscus. You can see here there are different types of the meniscus damage, and diagnosis is done with the help of MRI or the arthroscopy. So poor healing will be there, that is due to lack of the blood supply. So there can be surgical removal of the meniscus also. The arthroscopy of the knee joint, it is an endoscopic examination or the visualization of interior of the knee joint cavity with minimal damage of the tissues. The ligament repair or the replacement can be also performed by arthroscope. Second one is known as knee replacement. If the knee joint is badly damaged by osteoarthritis, an artificial joint consisting of the plastic tibial component and the metal, the femoral component, what you can see here in the diagram, is connected to the tibial and the femoral bone ends after removal of the damaged area. This is known as the knee replacement. You can see here in the diagram, this is known as knee arthroscopy and this is known as knee replacement. Third one is known as aspiration of the knee joint. So the collection of the fluids are common in the knee joint. So it gives rise to the swelling above and on the side of the patella. So to remove the excess fluid which is present in the knee joint, so joint is usually approached from its lateral side using the 3 bony landmarks or the points for the insertion of the needle. That is the tibial tuberosity, lateral epicondyle of the femur and the apex of the patella. Housemaid bursa, also known as the housemaid knee, inflammation of the prepatellar bursa or prepatellar bursitis is known as housemaid knee, occurs due to friction of the bursa against the patella when it comes in contact with the ground during scrubbing of the floor by the housemaid. You can see here in the diagram. So here there can be a prepatellar, the bursa inflammation or the bursitis. Then Baker's cyst, the chronic inflammation of the bursa deep to the semimembranosus, showing a cystic swelling in the medial part of the popliteal fossa. So this is known as the Baker's cyst on the posterior aspect of the knee joint. Clergyman's knee, inflammation of subcutaneous but infrapatellar bursa, occurs due to friction of the bursa against the tibial tuberosity due to kneeling downwards. Example, kneeling during the prayers by the Christian or the priest or the floor tilers. Q angle, also known as quadriceps angle, it is angle formed by the line drawn from the anterosuperior iliac spine to the center of the patella, and the second line from the middle of the patella to the tibial tuberosity, and these lines representing the pool of quadriceps muscles and the axis of patellar tendon. You can see here in the diagram, quadriceps angle or the Q angle is nearly 11 to 14 degree in the normal individual, a little bit more will be in the female. So this is known as the normal, the alignment or the Q angle. Now if there is a decrease in Q angle, that is known as bow legs, that is also known as genu varum. Whenever there is an increased Q angle, knock knees, that is also known as the genu valgum. The second diagram, B number, is showing the genu varum and third one is showing the genu valgum. The next clinical aspect is known as the collateral ligament injuries. So there can be a damage of medial collateral ligament or the lateral collateral ligament, but medial collateral ligament is commonly damaged ligament in the knee joint. The medial collateral ligament can be sprained or torn as a result of blow to the outer side of the knee, and medial collateral ligament or the injuries are often the result of valgus stress applied to the stationary knee joint, which puts enormous strain on the ligament during time of standing position.